Okay, so this is about, oh, no, sorry, previous slide. So these are the stages of the disease: osteochondrosis latens, manifesta, and dissecans, which is, the final name of the disease. So latens is when you'll see cellular evidence of, let's say, necrosis without any clinical signs, so just cell death, really. With manifesta, you'll see clinical signs and X-ray evidence, but you won't see any of the articular cartilage actually coming off. And finally, you can see the cartilage coming off in osteochondritis dissecans. So basically, the typical osteochondritis patient is a yearling, meaning they're about a year old. And what they have is a fusion of one or more joints. So in this case, it's two. The age may vary. So osteochondritis often becomes manifest, let's say, around the age of training. So when the horse is 2 to 4 years old. And it's also in fast-growing breeds, and they've written them here, so I'll show them to you so you recognize them. It says KWPN, don't know what that is. Cell Francais, other warm blood, standard bred, thoroughbred, race horses. This usually occurs in the tarsocrural, femoropatellar, metacarpo, metatarsophalangeal, so just remember these. And the horse usually is not, say, or barely lame. You'll often just see lesions, during examination. And so what we do is, like, we'll do something called a positive flex test. We'll look for lesions of osteochondritis dissecans, because it's always at specific sites. And you can also do x-rays. These are, like, obviously the gold standard for diagnosis, to see irregularities, flattening of the articular surfaces, see if there are loose fragments. It also says, ignore the picture, but it says cartilage lesions are usually more severe than an x-ray also suggests. What are the predilection sites? The cranial side of the distal intermediate ridge of the tibia. Okay, so I'll say the front of the tibia, the distal end of the lateral trochlea of the talus, and the medial malleolus of the distal tibia. Sorry, I don't know what most of these are, but hopefully, yes, so this helps. So the green part shows you the cranial end of the distal intermediate ridge of the tibia. This is the medial malleolus of the distal tibia, and this is the distal end of the lateral trochlea of the talus, but I imagine the questions will look like that. So this shows you, I'm trying to show you the words as well: dorso 35-degree medial, planto-lateral oblique view. I don't know if this is important, but I'm just showing it to you. I don't know why this could be important, but it also mentions osteochondritis of the tarsocrural joint. So what will you see? It mentions, here you'll see an osteochondritis dissecans fragment. So you can see this is mostly radiolucent, and you have a fragment here on the distal intermediate ridge of the tibia, and this is leading to a swelling, as I mentioned before. So you might not see lameness, but you'll see swelling. So this is osteochondritis of the tarsocrural joint as well. Here again you can see a fragment on the distal end of the lateral trochlea of the talus, so that might come up. I'm just going to skip that, but yeah, you can do a dorsoplantar view. So they might ask you questions like, what kind of view will you do, maybe. This shows you osteochondritis of the tarsocrural joint, so it shows a fragment on the medial malleolus of the distal tibia. Now this is a bit easier. If you have osteochondritis of the femoropatellar joint, the predilection sites, I'll show you the words as well. You have the lateral trochlear ridge of the femur. I'm just going to say it's here. The medial trochlear ridge of the femur, the trochlear notch, and the distal part of the patella, which you can't see here, but it's the knee. So you have osteochondritis of the femoropatellar joint. So you can see an osteochondritis fragment on the lateral trochlear ridge of the femur. It's really hard to see, but if you already suspect it by seeing the swelling, you have to look at these specific sites that I mentioned in the first slide, and it also shows an osteochondritis fragment on the medial trochlear ridge of the femur. And yeah, it just keeps showing fragments, really. So this is the femoropatellar joint. So why was there swelling? Well, here it's mentioning you have fragments on the lateral trochlear ridge of the femur. Here, so everything's a bit different. You'll see just like a small defect in the lateral trochlear ridge, and you won't see any obvious fragmentation within the swelling. And you would probably treat that conservatively. Now, you can see a fragment in the defect, and here you have multiple fragments in a more severe lesion. So if we're talking about osteochondritis of the metacarpal or metatarsophalangeal joints, to be honest, they're quite subtle to me, but I'm going to take this more obvious picture. So it will say the predilection sites are the dorsal aspect of the sagittal ridge of metacarpus 3 and metatarsal 3, the dorsoproximal aspect of P1, palmar or plantar eminence of P1, or metacarpal or metatarsal 3 condyles. I'm so sorry, I think that's the only way I can like show it to you, so I think pictures might help. So this shows osteochondritis of the metacarpal metatarsophalangeal joints. So you can see an osteochondritis fragment on the dorsoproximal aspect of the proximal phalanx. Here, this little nubbin here, I'll show you the words as well. It shows you a lateromedial view showing the osteochondritis fragment on the dorsal side of the sagittal ridge of the carpus. So the sagittal ridge, so this is the sagittal, I assume, this is the ridge, and this is the metacarpal area, and the fragments on the dorsal side. So yeah, the dorsal surface. So this is also going to be confusing, so I'll stop here.